My name is Dina Gill, and welcome to the first segment of Let's Talk About It for the 21-22 school year. I'm here with our panelists to discuss a very taboo and uncomfortable topic for some, suicide. Suicide is the second leading cause of death for those ages 10 through 34. Suicide is also the 10th leading cause of death for those in the United States. With me today is Janice Williamson, school social worker, threat assessment team, and youth mental health first aid instructor. Samantha Stone, alcohol and drug counselor, and our special guest of honor, Ms. Debbie Barrett, manager of the opioid epidemic prevention efforts and coordinator of the Overdose to Action, high impact area grant for the Shelby County Health Department. Welcome, ladies.
Thank you, Dana. Good to be here.
So, as we are talking about suicide, let's talk about some facts, right? Myths versus facts. The Youth Risk Behavior Survey is conducted every 2 years by the CDC, and Memphis is the only district that's being chosen for is Shelby County Schools. So 36% of high school students felt sad or hopeless for 2 weeks in the past year. 36%. Mm-hmm. That equals to 1,368 students who felt sad or hopeless for those 2 weeks. Is that shocking?
It is, and that's 1/3 of the students that were in the that participated in that assessment.
Yeah, that's a large number. You know, when you consider and think about students, you think about this should be a time of life, you know, when they're enjoying their being with family and friends, and some of our students are experiencing so many mental health issues and crises that they're considering taking their own lives.
And speaking of taking their own lives, 15% actually attempted suicide. That's 1,104 students who actually attempted suicide in high school, and 1,386 middle school students reported they had attempted to take their own life. Now, these reports are from 2019. The CDC does a youth risk behavior survey every 2 years, so the next test assessment will be done this spring of 2021.
Yes.
And we have Ms. Barrett here. I mispronounced your name earlier. I do apologize. Okay. We have Ms. Barrett here to talk and share personally about her experience with suicide and how it's affected her family.
Yeah, those numbers don't surprise me. Having experienced it and knowing what I know now, my stepson, he was 21 years old when he committed suicide. However, his problems began long before that, and we came to find that when he was in middle school, he was acting out because of issues that he had, and he was depressed and had a lot of behavior problems, academic issues, and just emotional problems that we didn't know about, and things that he didn't tell us until he was older and could express them. So those numbers don't surprise me at all.
And he touched on a very important topic that we need to emphasize to parents is the warning signs.
Yes.
What to look for if your child is struggling. Like you said, they were having some changes in their mood, they were withdrawing, they also were not able to express themselves, so they were behaviorally acting out as a way to get help and attention. So thank you so much, Ms. Barrett, for sharing your story.
Thank you.
Dana, you know, when I was listening to Ms. Barrett's story, I think about how often that, especially in the African American community, mental health is taboo.
Yeah.
You know, and they say, oh, you're crazy, you're this or you're that, and so it's not acknowledged a lot of times as being a mental illness. You know, when our children are suffering with depression and other mental illnesses, but it makes me more aware that we've got to be more diligent with helping parents to identify these signs and symptoms, you know, that their child could possibly, you know, be dealing with a mental illness that could lead into them possibly trying to commit suicide. And if they know the signs ahead of time, then they can do so much more to help their children.
Well, I wanted to mention that some of the signs that parents need to look for are, of course, are students who are young people who actually make a threat to harm themselves, to talk about it in writing or sharing it with someone, to expressing hopelessness, the use of substances. Sometimes young people feel trapped and think that there's no other way than to kill themselves. And of course, increasing alcohol or drug use, because we know that the use of alcohol and substances lowers inhibitions, and then students or young people may feel more apt to taking their lives.
Yeah. It's important as a parent also, when you see those signs, to take it seriously, because my son experienced those. He talked about harming himself, and he actually did it before. He had tried twice, and as a parent, we thought he was just trying to get attention. And we took him to the counselor, however, because it's still alarming when your child does something like that, and it's still a behavior issue that needs to be addressed. But we never, ever imagined that he would actually go through with it. So when you hear them say anything about taking their lives, and especially if they attempt it, it's something that really needs to be taken seriously.
Yeah, and some of the other things that we could possibly notice, with our students is that they lose interest in things that they love to do.
Yes.
If you know that your child, loves basketball, loves sewing, and all those wonderful things that they do, being creative, hanging out with the girls or hanging out with the guys, and then all of a sudden, all of those things that they love to do, they just totally lose interest, and they don't want to do them anymore.
Yeah.
I mean, that's a big sign. When they start giving away their prized possessions and things that they treasure and they wouldn't let anybody else hold on to. Those are big signs that we just cannot afford to ignore.
And when you see those signs, withdrawing, isolation, loss of interest, changes in mood, behavior, a lack of sleep, sleeping too much, eating too much, sleeping too little, how are you supposed to respond? I'm sure you're wondering. Well, it's important not to appear shocked, to not be judgmental, and to create a safe place for that child. Wouldn't you agree, Mrs. Barrett?
Absolutely, absolutely. My son did some of those things, but he went on the opposite. He started, he withdrew and he started sleeping a lot, but he started making contact with people he hadn't talked to in a long time, and he was kind of making his goodbyes to everyone. He went on a spending spree, and he purchased tens of thousands worth of dollars from designers, and there was no way he could have paid for those things, but there would be no reason for it in the end. He wrote letters to people, so he was really resolved in some of the things he did. But from a parental standpoint, if you should see things like that, it's real important that you make it safe for them to say how they're feeling, and get professional help. If you don't know what to do, get professional help. Yeah. I sought advice from someone, and my son was struggling with another issue that we later found out. He was gay, and he was afraid to say that out loud. And someone told me that being a teenager and feeling that way at his age, that it was the time that they generally commit suicide, and that I really need to be watchful of that. And exactly 1 month after I had that conversation with her, he was dead. So as a parent, it's real important that you start looking for those signs. The other thing that we didn't do as a family or as a community around him is we weren't talking to each other, because all of us saw different facets of him, but we didn't all put it together until after the fact, and that's too late.
Yeah.
And so it's really important to continue to conduct check-ins, monitor their behavior, and don't be afraid to ask if they're having suicidal ideation. There's it's a myth, right, ladies?
Yeah,
if you ask
absolutely.
about it, that they're going to start being suicidal. Please ask, check in, and don't be afraid to get the help that's needed.
Yes.
And
And
I'm-
another thing, go
Go
ahead.
ahead.
Go ahead.
I'd like to mention that the Shelby County Schools has a course that district staff is available to district staff called Youth Mental Health First Aid. And in Youth Mental Health First Aid, we actually teach participants how to recognize signs and symptoms of mental health challenges, including suicide. And in the suicide portion, we actually encourage participants to talk to the youth about what they've noticed and to ask directly if the student is considering suicide, not necessarily the student, but the young person. Are you thinking of killing yourself? Ask directly. Don't be shy and avoiding it. Ask them, are you thinking about killing yourself? And we cannot understate or underestimate the role of the family. And the family is not necessarily a biological person, but it's whoever the student or the young person feels is their family.
Yes.
And also, we can't keep that a secret. If a young person says, I
right.
want to tell you something, promise not to tell. We can't do that because we're here to help and to save lives. And again, in this program, Youth Mental Health First Aid, we're trying really hard to reduce and decrease stigma because we know that mental health is something that people still whisper about. People worry about losing their jobs, losing relationships. So we're encouraging people to take this course to learn how to destigmatize mental illness and to increase mental health literacy and to save lives.
Amen.
Exactly.
In addition to that program, Shelby County Schools Mental Health Center also assesses crisis in the school setting. What will happen is if a student states that they have suicidal ideation or exhibit some suicidal ideation behavior, they will inform the professional school counselor. The professional school counselor will call the Shelby County Schools Mental Health Center. They will dispatch a clinician that will then conduct an assessment and follow up with the parents to determine what level of care the student may need and how best to support them in the school setting. Does anybody want to touch on our emergency response in the school setting?
Well, just before saying that, I would just like all parents to know that the Shelby County Mental Health Department has a licensed clinician in every school. So maybe if you're seeing some of these signs with your student, with your child, and you don't know what to do or where to start at your school and ask for the mental health clinician that's there in your school. And that would be a way that you could start to help your own child if you don't know exactly where to go or where to reach out. Shelby County Schools Mental Health Department is here for you in every one of our schools.
And maybe you're apprehensive about reaching out. We have a phone number that you can call. It's the Social Emotional Support Line at 901-416-8484. It's open Monday through Friday from 9 a.m. to 4 p.m. So reach out. Maybe you're uncomfortable talking to the principal or the professional school counselor at your school, or even asking for the mental health clinician. You can call this number at 901-416-8484, and they will link you up to your school's clinician.
Okay. One of the other things, though, that I would like to mention about the mental health department, because, you know, oftentimes we connect and we talk about drugs and alcohol with mental health issues, and that's a way that students or adults or anybody may try to cope with different things that are going on. The Shelby County Mental Health Department also has an alcohol and drug team, and I'm a part of that team, and we do work with the 7 Challenges program to help our students with any issues with alcohol and drugs. So we want to be able to let our families know that we're here to help you in every capacity that we can. And this program is also evidence-based, so we're not just here throwing things together. We're here to work with you and your family to help the whole child.
And it's really important to mention that all these services are free, from the youth mental health first aid training to alcohol and drug counseling to speaking with your mental health clinician in your school and them providing services in the school setting. It is all free, so please reach out if you need help. There are also some available community resources that we would like to leave you with as well. You can text TN to 741-741, as well as contact the Memphis Crisis Center at 901-274-7477, or Youth Mobile Crisis at 1-866-791-9226. And for our Spanish speaking, 1-888-628-9454, but also please reach out to your Shelby County Schools Mental Health Center at 901-416-8484. Ladies, do you think there's anything else that we need to touch on?
Just like to encourage people to take all threats of suicide seriously, and please, please don't use guilt or threats telling a young person that they're going to hell, which we hear a lot. Young people say, you know, my mom said I'm going to hell. Let's just be encouraging and listening non-judgmentally, which we talk about in Youth Mental Health First Aid, and encourage the young person to get professional help if needed.
I encourage all parents to get involved in your children's lives. Talk to them, know who they are, know their friends, and don't be afraid to do that. Not all children are going to welcome it, I'm here to tell you, but it's still the right thing to do.
Yeah, I think I would just like to say that the stigma that is attached to mental illness, that we've got to work collectively, not just on our end, but as a community of people in the family, at the schools, to destigmatize mental health. Because if your child was sick physically, you would take them to the doctor. And mental illness is just that. It is a mental illness that we need to work together so that our students will receive the help that they need.
Well, thank you all for joining us. Please be aware of the warning signs of suicide, as well as what to do when you're faced with your child or someone in the community that are exhibiting suicidal ideation and behavior. Please acknowledge, tell them that you care, and seek a trusted adult, whether that's your primary care physician, a mental health clinician in the school setting, or those outside resources we gave you earlier in the segment. I also want to tell you about a community outreach program that will be at the Teacher Learning Academy at 2485 Union Avenue on October 2nd. It is for suicide prevention. We will have door prizes, a scavenger hunt, food, beverages, and a plethora of knowledge for you. So please come out and gain awareness and information about this important topic that is plaguing our community and our teens and young adults. So come out to the Suicide Prevention Expo, October 2nd from 11 to 1 at the Teachers Learning Academy. We hope to see you there.